接下来呢，伟大的功能医学演讲家马尔海门又回来了。他呢，接下来给我们讲2堂课。那么他要用功能医学的方式来解读一个大家都非常关心的疾病，或者说综合征，是什么呢？因为它是人类到现在为止的第一杀手，就是心血管疾病。所以他演讲的题目呢，这2堂课的题目都叫做A functional approach to the diagnosis and treatment of cardiometabolic diseases。它是分2部分，1和2。这里边我想强调的就是，我们学了这么多功能医学的基础的理论，其实它应用到疾病或者综合征当中，最完美的目标就是心血管疾病。因为心血管疾病呢，跟代谢综合征呢是同胞姐妹，息息相关。特别是我们谈到代谢综合征，很重要的一个疾病，大家都很熟悉，就是糖尿病或者叫糖不耐受。那 Mark Hyman 在这方面有美国最畅销书关于血糖的糖的代谢的畅销书，所以 Mark 在这方面不但是专家，而且他有很多病例可以引用进来。那么最让我感动的是，他用了很多中国的数据、亚洲的数据，而不完全是欧美的数据，所以他的演讲非常有的放矢。所以在这里面呢，头一节课他讲的主要是围绕着心血管疾病和代谢综合征，他讲了很多功能医学的基础的理念和临床应用比如说胰岛素拮抗怎么来进行诊断，最后怎么来进行理解胰岛素拮抗跟心血管疾病之间的关系，让我们再进一个层次更深一个层次来理解心血管疾病的原因。好，那么这节课应该说是非常精彩。
I'm going to talk to you this morning about a topic that would not have mattered in China 30 years ago. 30 years ago when I came to China, diabetes was pretty much non-existent, heart disease was pretty rare, and now China is number 1 in the world in diabetes. In just 30 short years, you've gone like this. In fact, I think it's probably going to be the single biggest threat to your economic development and growth as a country if you don't address this. So we're going to talk today about heart disease and diabetes and prediabetes, because these are the conditions that are going to become more and more common and cost more and more money, driving up healthcare costs and creating a huge crisis in this country, because we don't have enough doctors and healthcare workers to take care of all the sick people with this problem. So we have to find a way to treat it early and to prevent it, and to create programs and treatment models that can address this on a social level. And we'll talk a little bit about how I mean to do that. What I want to do today is give you an insight into how functional medicine views these conditions very differently. Typically, when someone comes with a heart attack or diabetes, we use medication to treat it. We use surgery, we use angioplasties. And what we're finding is that these treatments are not very effective. That if you get diabetes and you start on diabetes medication, you need more and more and more medication. And then you need insulin. And then you need more and more and more insulin. And you keep getting sicker and sicker and sicker. So our current methods don't work very well to manage these problems. In fact, the alternative is to use a model of functional medicine which can reverse the problem. It can literally turn back the clock and change your biology so that you become not diabetic. You can get off insulin, off medications. We see this all the time. Same thing with heart disease. We know that our treatments are medications or cardiac bypass surgery or angioplasty, but they are ineffective for most of the people that have them. I don't know what the statistics are in China, but in the United States, less than 3% of angioplasties work to reduce second heart attacks or prolong life, and yet we do them all the time. And the same thing for cardiac bypass. They don't prolong life in most of the cases that they're used to treat patients. So we have to think very differently about this problem. I believe that the root cause of most heart disease and most, obviously, diabetes is a problem we call metabolic syndrome or insulin resistance. Now, this wasn't even described until maybe 20 or 30 years ago, but I think is the root cause of most of the cardiovascular disease we see today around the world. And understanding this phenomena is very, very important. My last book was called The Blood Sugar Solution, was about this problem of diabetes, going from healthy to a little bit of belly fat to prediabetes to type 2 diabetes. The problem in medicine is we usually treat people once they're here instead of all the way along here. So functional medicine is a way of thinking that helps us to create an early assessment and diagnosis and treatment way before you even get to a severe problem. In China, 60% of those who have full-blown type 2 diabetes, 60% are not diagnosed. That's terrible. In fact, they're only diagnosed once they already have a severe problem, such as needing an amputation of a leg, or having kidney failure, or going blind. Then they get diagnosed. But that's far too late. We can deal with this problem much earlier. And my last book, which I hope soon will be translated into Chinese, is about how to deal with this problem and solve it at 3 levels. The first level is using functional medicine to deal with the root causes of this problem. Now, you may think that it's all about poor diet. It's all about what you eat, and it is mostly about what we're eating. But there are other factors we're learning that are causing insulin resistance. So the fundamental mechanism is a problem we call insulin resistance, which is where your cells become numb to the effects of insulin, where the effects of insulin are blocked at the cellular level, and you need more and more insulin in order to keep your blood sugar normal. This is the fundamental pathology, and insulin is a hormone that's a fat storage hormone, and it stores visceral fat, belly fat. And this is a dangerous fat. We're going to talk about visceral fat in a minute and why it's so dangerous. So the first thing is using functional medicine to assess the root causes, which could be diet, it could be environmental toxins, it could even be your gut flora. The microbiology of your intestines can play a role in creating inflammation that can cause diabetes and heart disease. It can be chronic stress. It can be other factors that are hormonal that all drive the same pathology. So you have to get to the root cause and treat the root cause. Now you can see here that the diabetes rates in China and the United States are almost the same. It's about 1 in 10. About 30 years ago in China, it was 1 in 150. So in a very short time, you've gone from 1 in 150 people having type 2 diabetes to now having 1 in 10. You're right there with America. But you're number 1 in terms of population in the world because you have such a big population. And you can see the rate of change. In China, in the United States, diabetes rates are going up. But in China, they're going up much faster. Much, much faster. So the trajectory of this is terrible. In diabetes in Asia, we're seeing an increasing prevalence. 60% of the world's diabetics are in Asia. And they're often found in younger and middle-aged people, not just older patients. And here's something very important, that it can happen if you have a low body mass index. If your weight is low, you can still have type 2 diabetes, especially Asians, because even though they may not get to have a high body mass index, at a lower body mass index, they become diabetic. Why? Because they can accumulate visceral fat around the belly, even when they're not massively overweight, and that creates a problem we call metabolically obese normal weight. In other words, they look skinny, but they're fat on the inside. Skinny on the outside, fat on the inside. And you can test for this. There's very specific blood tests you can use to identify this. There's body composition testing you can use to identify this. to help you know if someone has this metabolically obese normal weight syndrome, or what I call the skinny fat syndrome. Now, there are many reasons for this increase in Asia and diabetes. Our Western diet, when I'm driving around Beijing in the car, I see KFC, McDonald's, I see ads for Coca-Cola, I see all the horrible things that we're importing. You're exporting a lot of good things, like my iPhone. But you're importing all the bad things, like KFC and McDonald's, which is very bad. Because although it may be sexy and it may be fun and it may be different and novel, it's really poison. These foods are poison. They're addictive. They trigger hormonal changes in your body that drive disease, that are the root cause of obesity, diabetes, and heart disease, and cancer. This data is very well proven. They're also proven to be addictive, biologically addictive. So Coca-Cola, processed food are very addictive. In fact, the food companies in the United States are very strong, very powerful. There's about 10 companies that control $1 trillion worth of the food industry in the United States. $1 trillion. And there's 10 companies that control this. And they are very smart about getting their customers to eat more and more of this bad food, which, when used as prescribed, actually causes disease. So the other factor we're learning is interesting, is that environmental toxins, pollution, pesticides, chemicals, mercury, lead, coal. A lot of people burn coal in China. Coal releases a lot of particulate matter, but it also releases mercury and lead, and these have been shown to be linked to diabetes. So we're seeing many things, not just Western diet, but maybe effects of industrialization as well. And of course, gestational diabetes is increasing in Asia, and we see these increasing risks in China. Now you can see what's happened in China in the fast food market. I was here in 1994. Well, in 1984 there was nothing when I came. In 1994 we saw maybe one McDonald's, maybe one KFC, and now they're everywhere. Starbucks, McDonald's, and you can see the growth of the fast food industry in this country has just gone up dramatically. I showed this slide my first day, and you can see how they predicted that in 2030, okay, that's 20 years from now almost, they predicted that there would be going from 20 million Chinese with diabetes to 42 million. Okay. 3 years later, they did a study, and they looked at the prevalence of diabetes in China just 3 years later. And they found something very shocking. This is from the New England Journal of Medicine, where they did glucose tolerance tests on Chinese. And they measured prediabetes and type 2 diabetes. Am I talking too fast, too slow? Okay? Ding to dong ba? Everything okay? Okay. Sometimes I talk too fast. I want to make sure I'm not talking too fast. Okay. So this is a study that was very impressive to me because it showed that there's a huge prevalence of diabetes in China, and it's increasing. We saw 93 million diabetics in this study, up from 42 million they predicted in 2030, but in 2010 it's already exceeded more than twice that. And there's 148 million pre-diabetics. It's probably even more if you use more liberal criteria. They use standard definitions. But if you look at this as earlier, you can look it up earlier in the continuum, you could probably even see there's more people who are suffering from this. And the reason this is a problem, it's not just about diabetes and heart disease, but this problem of called diabesity or insulin resistance is a major cause not only of heart attacks, strokes, not only of diabetes, but also of many cancers. Prostate cancer, breast cancer, colon cancer, liver cancer, kidney cancer, pancreatic cancer, all increase with this problem. In fact, also dementia is another big problem. We now call Alzheimer's disease type 3 diabetes because insulin resistance in the brain is causing dementia. So when you eat sugar, it makes your brain shrink. It makes your belly grow. We want the opposite. We want our brain to grow and our belly to shrink. Okay, and this is what we're going to learn today how to do. It also threatens economic development in China. In 1974, as I said, there was less than 1 in 150 people in China with diabetes. In 2012, it's 1 in 10, and in the population over 60, it's 1 in 5. That's a lot of people. In China, when I came 30 years ago, the predominant problems were infectious disease. I've studied a lot about China and read many books about China and about what China was like before the revolution in 1949 and the kinds of diseases they suffered from and the malnutrition, the starvation, the infectious diseases. And now, a short time later, less than 1 or 2 generations, 2/3 of all the disease in China, 2/3 of all the disease in China are lifestyle preventable chronic diseases like diabetes and heart disease. Today, diabetes comprises 13% of China's healthcare costs. I think this is a gross underestimate because it only includes the 60%, the 40% of Chinese diabetics who are actually diagnosed. That leaves 60% who are undiagnosed and leaves almost 100% of the pre-diabetics who are undiagnosed. Nobody's looking for this. When I was in medical school, nobody taught us how to diagnose insulin resistance. How many people here know from their education how to diagnose insulin resistance in the clinic? Anybody? Nobody? Anybody? Mayoran? Okay, well that's what you're going to learn. It is very important. This is one of the most important things you're going to learn during this conference is how to diagnose this, and you'll be so surprised at what you're going to find. And it's a very easy thing to diagnose. It's also very easy to treat, but there's no medication to treat it, and this is why it's been neglected, right? Because if a doctor doesn't have a prescription, then what can you do? Nothing. But you have to do something. You have to intervene with intensive lifestyle treatment. Most people think that lifestyle, what you eat, exercise, managing stress, so forth, controlling your environment, are only important to prevent disease. But in fact, they're the most powerful tools that you have to reverse disease. It's not like a second best to a drug. It's way better than any drug. So what is metabolic syndrome? So when I talk about insulin resistance, this is the primary biological mechanism. And it results in a clinical syndrome called metabolic syndrome. It's had many other names, but we'll call it today metabolic syndrome. And it creates many problems, but it's all the same problem. So we're going to think about this in this way. When you have a condition, often we see the leaves on the branches of the trees. You see heart disease, you see stroke, you see dementia, you see cancer. These all seem separate, like they're on separate branches of the trees, but they're all connected by the same root cause. And the same mechanisms are driving these diseases. So we see, oh, we have high blood pressure. I have a patient with high blood pressure. I have a patient with diabetes. I have a patient with heart disease. I have a patient with dementia. These are all the same disease, showing up in different ways in different people. So functional medicine is a medicine that treats the cause. It's a medicine that looks at the mechanism of disease. When we learn medicine by symptoms and diagnosis. So we learn how to understand what disease someone has by the symptoms they have, and then we gave them a label or a diagnosis. In functional medicine, we think differently. We think about the mechanism. What is the underlying biology? What is the physiology? What is the biochemistry? What are the genetics? What is going on a cellular level, on a biochemical level? So what is the mechanism? And then what is the cause of the disturbance in that mechanism? And I said to you the other day, the textbook on pathology that we read in medical school says that every single pathological change is always preceded by a biochemical change. So metabolic syndrome, we see many things. We see increasing visceral fat, increasing fat on the omentum, around the organs. This is a different kind of fat than you have on your legs or your thighs or your butt. It's a very dangerous kind of fat. It's pro-inflammatory. It increases cytokines and inflammation that you heard about from Dr. Roundtree. It increases your risk of clotting. It's prothrombotic. It causes vascular endothelial dysfunction, leading to high blood pressure. In fact, when you diagnose someone with high blood pressure, the cause, most of the time, is insulin resistance. That if you treat the insulin resistance, the blood pressure will go away. There are other causes. Maybe it can be sleep apnea, or it can be heavy metal toxicity, or it can be some renal problems. There are other causes, but for most of the patients with high blood pressure, the cause is insulin resistance. And it also produces a type of cholesterol that's more atherogenic than regular cholesterol. So we're going to learn about the different types of cholesterol. In medical school, we learned that all cholesterol is the same. You have LDL, and all LDL is the same. There's HDL, and all HDL is the same. And really, all you want to do is get the cholesterol down. This is just a wrong idea. In fact, there are people with very high cholesterol that don't have heart disease, and there are people with very low cholesterol that do have heart disease. And it matters about the type of cholesterol. And metabolic syndrome and insulin resistance cause the most dangerous type of cholesterol. They're small, dense cholesterol particles. They're like little golf balls that smash into your arteries and cause damage, as opposed to light, fluffy beach balls that bounce right off your arteries. So how do you diagnose it? Well, there's some conventional parameters. But I want you to understand that these definitions are arbitrary. So over the years, we've changed the benchmarks. We've changed the normal ranges for so many things. Before, we thought blood pressure of anything under 140 over 90 was good. Then we said, no, maybe it should be 120 over 80. Then we go, oh, no, maybe it should be 115 over 75. The reason we keep changing is we realize that even at earlier stages, at lower levels, there's disease. Same thing with blood sugar. Normal blood sugar was anything under 140 was considered not diabetes. Over 140, diabetes. They said, no, it should be 126. Why 126? What if your blood sugar is 123? Is that okay? It's not okay. It's a continuum. So we have a continuum of disease all the way from optimal functioning, super healthy, slowly to full-blown disease. And where we set those benchmarks is arbitrary. What I'm interested in is getting to the most optimal level of health, not just not meeting the criteria for some illness. So the same thing with diagnosis of metabolic syndrome. We have certain agreed upon standards, but I think they're missing many patients who have even earlier disease. So what are the things we look at? These are easy things for you to test in your office. You look at your waist size. So maybe they're not overweight, but they have a fat belly. So it should be that their waist should be, in Asians I think it's even smaller, but if you see they have a little pot belly, then there may be a sign of diabetes. In Americans, the cutoff is 35 for women and 40 for men for belt size, 40 inches, but it's different I'm sure here. Increasing blood pressure, increasing blood sugar over 100, increasing triglycerides over 150. Now, James, I don't know if the same units are here. They're different units, right? So I don't know how to translate those units exactly, but basically you're looking at increases in triglycerides and increases in blood sugar and decreases in the good cholesterol. And these are the parameters you can see here. They translated the numbers. So you see waist circumference over 40 in men, 35 in women. I don't think this applies to Asians. I think at a much lower waist size, they're going to have problems. Triglycerides, anything over 1.7, I think it should be anything over 100, but I don't know what 100 is like that. Reduced HDL under 40 in men or under 1.04 in men and less than 50 in women. Blood pressure over 130, over 85, and sugar over 5.5. Okay? So these are the cutoff points. But I think that when you look at, for example, this here, they've done large studies where they've taken people and looked at their blood sugar progression. And anybody who had an increased blood sugar over 85 had a progressive increased risk of heart disease and damage. So maybe 100 isn't normal. Maybe 70 to 80 is normal, and everything over 80 is slowly moving towards more risk. Does that make sense? And maybe the blood pressure should not be 130 over 85, it should be 115 over 75. And the triglycerides should be less than 100. So these numbers are helpful, but they're going to miss a lot of people who have early disease. So let's talk about what happens. Many conditions happen as a result of this. Type 2 diabetes, cholesterol problems, heart disease, sexual dysfunction, number one cause. It lowers testosterone. So if you're a man and you have pre-diabetes, you lower your testosterone. You lower your ability to have an erection and have interest in sex. And you get sexual dysfunction. In women, you get actually increases in testosterone. So women lose the hair on their head. They lose their hair on their head. It gets thin like a man. And they grow hair on their face. They get a beard, or they get more abdominal hair and more hair growth on their body. And they also get infertility. I know, having children is very important for all of us. And pre-diabetes and metabolic syndrome is a major cause of infertility. It also, as I said, causes type 3 diabetes or dementia. We know that pre-diabetes causes pre-dementia. We call it MCI, or mild cognitive impairment. What this means is that when you have a big belly, you have a small brain, like a dinosaur. Cancer, we mentioned cancer. End-stage renal disease, osteoporosis, fatty liver. Now this is interesting. In America, this is the single most common disease, non-alcoholic fatty liver. Because what happens when you eat sugar, when you have your Coca-Cola, it has high amounts of fructose. And it has free fructose. Sugar has glucose and fructose. When you have Coke, normally when you have sugar, it's combined together. There's a bond between the glucose and the fructose and sucrose. But when you have Coke, it's separated. It's high fructose corn syrup. This is a very dangerous compound that's in our food. And it's in everything. It's in all processed foods. And this fructose quickly is absorbed. It doesn't raise your blood sugar, but the fructose goes right to your liver and induces lipogenesis, generates the production of fat, triglycerides, increases inflammation and cytokine formation. So you get higher levels of C-reactive protein. It increases insulin resistance, and it leads to more visceral fat deposition. This is the single biggest toxin in our diet today. When it comes in the form of fruit, where you get fructose, it's fine, because there's fiber, there's minerals, there's vitamins, it's more slowly absorbed. When you have it in a soda, it's the biggest problem. In the United States, 15% of our calories come from soda. 15%. The average American eats 20 to 30 teaspoons of sugar a day. The average 20-ounce soda, I'm going to ask you, how many teaspoons of sugar are in one 20-ounce soda? Can you answer me? Nitudama? Wujada? 15 teaspoons of sugar. Shuwu. 15 teaspoons of sugar in one soda. And sometimes people have 2 or 3. This is a lot of sugar. And it causes a fatty liver like foie gras in French food. Obviously, it causes obesity, sleep apnea. It also causes muscle loss. So if you look at insulin resistance, it is the major cause of aging and all age-related disease. If you want to think about anti-aging, this is the single biggest thing you have to think about. Is how do you diagnose it? How do you reverse it? How do you treat it? This is the single most important thing because every single age-related disease is driven by insulin resistance. If you have insulin resistance, you lose muscle. And then you become more insulin resistant. And it's a vicious cycle. Does this make sense? Ting the dongma? Okay. So what happens here is important. So normally if you look at sugar with a glucose tolerance test, take a sugar drink, and you see a spike of sugar, and you come down, it's all fine. But you don't see a big change in sugar initially. You don't get this is before you get diabetes. If you have belly fat, that's the red line. This is really important. If you see you have the green line is normal response to sugar. So you have something to eat, your sugar goes up a little bit, and then it comes down. When you have insulin resistance, your insulin, this is your insulin level. So your insulin goes up and comes down. But if you have belly fat, your insulin goes way up and then down. When your insulin goes up like that, that's the problem. If you spike your insulin, it's like a domino effect. It starts a whole cascade of changes in your biology that cause belly fat accumulation. It's the storage hormone for belly fat. It increases inflammation. It increases triglycerides. It lowers HDL. It causes high blood pressure. It causes brain damage. It causes your testosterone to go down. It causes you to lose muscle. It causes you to have a fatty liver. It causes you to be infertile if you're a female. It causes all of these things. So the key to good health and healthy aging is to keep your insulin levels even, not spiking like this. So again, this is unfortunately this is American data, but you look at the body mass index and the percents of body fat and the risk of metabolic syndrome. If you're overweight, you're obese, you have a 60% risk. But what we're finding is that even at lower weights, you can have this problem. And I'll show you the data. It's pretty scary. This is what we call metabolically obese normal weight, or skinny fat. So in China also, there's a lot of increase in obesity in kids. We're seeing little children being very overweight, being fed American food, and it's a bad problem. This was from American data. They showed that from 2000 to 2008, the number of teenagers with type 2 diabetes or prediabetes went from 9% to 23%. This is astounding to me. In less than 10 years, we went from 1 in 10 kids with prediabetes or type 2 diabetes, which is already a lot for a kid, right? To 1 in 4 almost. 1 in 4 teenagers has prediabetes or type 2 diabetes. This is happening at such a fast rate in our culture that's never been seen before. And these children are going to be having heart attacks when they're 20, strokes when they're 25, and needing kidney dialysis by the time they're 30. This is going to overwhelm the healthcare system. What was even more frightening was that in this study, they looked at the children and they found that 37% of kids who were normal weight, not overweight, but normal weight, had one or more risk factors for diabetes or insulin resistance. They either had high blood pressure, high cholesterol, or high blood sugar. Think about it. That means almost 40% of skinny children have prediabetes. 40% of skinny children have prediabetes. So even though the junk food that they're eating doesn't make them fat, it makes them sick. In adult studies, same thing. We found there's not many of us normal